Hello and welcome to Legacy IAS Academy. In today's video, we are discussing one of the current affairs topic, that is talking about falling fertility rate in India. So why are we discussing about this topic is because there has been a recent Lancet report, which is a very important magazine for health related data. Okay? So the Lancet report has said that India's fertility rate may dip to 1.29 by 2050. This is far low. As per the current value, our current fertility rate is 2.0. This will dip down to 1.29 by 2050. So this is a very alarming report. Secondly, the report also says that this rate will become irreversible. So we will never be able to gain back the replacement level fertility, or we will never be able to regain the original levels of fertility. Okay? Currently, this is the current data of average India in urban areas. So every lady who in her potential age of pregnancy, in her net age of pregnancy in an urban area is expected to give 1.6 children and 2.1 in rural areas. So what do we mean by the decimal number? This is just an average data. Okay? Bihar, Meghalaya, UP, Jharkhand and Manipur, only these states are left whose net fertility rate is greater than the replacement level fertility rate. Replacement level fertility rate is exactly 2.1, and all these states have value. These are the only states left in India whose value of fertility rate is higher than 2.1. Okay? The Lancet report also says that there is an average global reduction in fertility rate. Okay? So what do we mean by fertility rate? Fertility rate is the number of children that can be born, total number of children that can be born or likely to be born to a woman in her lifetime, in her age of pregnancy, in her capable age of pregnancy. How many children are she giving birth to? That is defined by the fertility rate. And what do we mean by a replacement level fertility rate? What is this 2.1? That means this couple is going to be replaced by the next generation. So this has to be close to a value of 2. So the parents will be replaced by next 2 children. Children will be replaced, one child as a parent will be replaced by the next child, and this is how it has to proceed. Okay? Now why are we waiting for a decimal number here? Why the replacement level fertility cannot be exactly 2? Because there can be so many other causes of death also. Okay? So because of other causes of death, this population ratio, population pyramid can be disturbed. So we want a little higher number, more than 2. So the idea of replacement level fertility is that 2 parents, male and female, should be replaced by 2 children, child 1, child 2. When they grow as parents, their spouse or counterpart, see female 1 and see female 2, their counterparts, spouse counterparts will be replaced by their children. So they will be replaced by their children. So that is what is the meaning of replacement fertility. Okay? So replacement level fertility needs to be close to 2.1, and only these many states are left in India whose fertility rate is higher than the replacement level fertility. Okay? So it is a relatively alarming report. Now what are the reasons for decline in fertility? First of all, because even during the times of Indira Gandhi and just after that, almost 15 years down after our independence period, we started discussing about family planning methods and welfare programs, because of which we have been able to control the death rate. Because of controlled death rate, there is also a recent decline in MMR and IMR values also. Because the death rate is declining, so people are gaining confidence that the child who is born will survive. If the child who is born will survive, so they will not be giving birth to multiple children. Because earlier CMR rate, child mortality ratio or infant mortality ratio, used to be very high. So the child would not usually cross the age of 5 years. That is why, to ensure that they have a progeny, a couple will give to multiple births. Okay? So multiple children will be born to a couple, so as to ensure at least 1 or 2 will be able to survive across their life. Okay? Now because we have been able to control these values, IMR, CMR and MMR values have been able to be controlled, so we have been able to control the death rate. Now because of controlled death rate, uh, we have consequently controlled the birth rate also, because now people have confidence that the child who is born will survive. Okay? We also are witnessing a falling fertility rate because of rising women empowerment. Now women are also starting to work. Okay? Female LFPR ratio has also improved. Female labor force participation ratio has also improved, because of which we now have uh, greater income coming to the family. So they do not want their children to be earning members of their family. They want their children to be educated, provide them better health services. Okay? So because of women empowerment also, fertility rate is being controlled, and the choice of adoption. So because more and more couples in India are choosing for adoption, so we have declining fertility rate. So they are opting to have less number of children. But there is also a very interesting thing which is going on, which is the reversal of intergenerational flow of wealth. Intergenerational flow of wealth matlab, earlier couples used to have multiple children. A couple used to have multiple children so as to ensure that all these hands will be acting as a labor and will be earning money to the couple, to the family. Now this was known as intergenerational flow of wealth. Now this has stopped because as we discussed, that the parents now do not want their children to be working. They want them to be educated, to provide them with better health services. So this intergenerational flow of wealth has now reversed. Now parents have started giving money to children for whatever purposes. There is a reversal. So because of all these reasons, there is fall in fertility rate. It is actually a good thing to to reduce the fertility rate. To control the fertility rate, it is actually good, because currently India is the most populous country in the world, surpassing China. We are the most populated country in the world. So it was very important for us to control the fertility rate. But the current decline in fertility rate, this is alarming. Okay? So why is it important to control fertility rate? Because it will improve labor productivity. So now we will be having lesser population per government ka bhi focus rahega. So they can provide with better social sector services such as insurance, health, education. All this can be better provided, which will improve the labor productivity. Better employment conditions can also be provided, because you have a controlled population to take care of. Okay? Enhanced participation of women in labor force will also be possible, because now more and more children will be educated, better health services, society will become more educated, so they will allow women to be employed in workforce. And reduced pressure on environment as well as agriculture, because now you have a controlled population ko handle karna is relatively easier. So you will be having lesser of pollution, less consumption of resources, rather controlled consumption of resources, plus the society will also be very much educated, so uska environmental impact can also be reduced. Food productivity can also be enhanced, because now you have educated farmers. Now you will be having educated farmers. So agriculture, maybe productivity can be enhanced, or damage to agriculture can also be reduced. Okay? So these are the advantages of falling fertility rate. But why is this a concern? The Lancet report saying that the fertility rate in India is about to come down to 1.29 by 2050. This is a serious report. So why is this a concern? Because of demographic disadvantage. What do we mean by demographic disadvantage? Now, currently, we have a huge set of population. This population will turn out to become old age population. They will turn out to become old age population. But we do not have sufficient population to feed upon this old age population, because the population is declining continuously. So you will be having more and more population which will be dependent. And to feed this dependent population, we do not have sufficient working age population. So decline in working age population will put us into a demographic disadvantage position. Plus, increase in non-developmental expenditure. Non-developmental expenditure such as pensions and subsidies. Government will have to start giving more of pensions and more of subsidies, because now you have a less working age population. And less working age population, matlab they require government support. For example, pensions and subsidies, they require government support. Okay? So there will be increased expenditure from this. It is expected that government should increase their expenditure in non-developmental side. Okay? Plus we will also be having labor shortage, because the working age population will reduce. Okay? So these are the concerns. So what should be the way forward? we need to have men assuming more and more greater household responsibility. If men are sharing the household cost, so women can choose to proceed with their career along with taking care of the children. Okay. Plus, so we will be having, so women will not, or a couple will not be opting to not have a child just on the basis that her career will be compromised. She can continue to have the career, whereas men will also share some burden related to household responsibility. Okay. We also need to undertake greater job creation. So working age population ke liye we need to ensure that even if we have small working age population, all of them should be employed. So government should increase the job creation and offset regional imbalances to handle migration. So this rural to urban migration has to be handled. We need to provide better employment opportunities in rural areas so as to ensure that there is no resource crunch in urban areas. So we have a challenge related to coming up, challenge related to population, and we need to handle it more tactically. Okay. With that, we come to the end of this topic. I wish you all the very best and thank you so much.